Are you feeling constantly tired, foggy, or short of breath? Your body might be secretly screaming for more oxygen. In this video, we'll reveal 10 often overlooked signs that your blood oxygen levels are dangerously low. Stay tuned until the end for a game-changing tip that could boost your energy levels through the roof. Let's dive in and uncover these critical warning signs your body might be sending you. But first, let's quickly understand what we mean by blood oxygen levels. Your blood oxygen level refers to the amount of oxygen your red blood cells are carrying. Normal blood oxygen levels are considered to be between 95% to 100%. Anything below 90% is considered low and can be cause for concern. Now, let's explore the signs that might indicate your levels are dropping into the danger zone. Sign #1, shortness of breath. Do you find yourself panting after climbing a flight of stairs? Or maybe you're out of breath just from walking to your mailbox. This could be more than just being out of shape. Unexplained shortness of breath, especially during activities that didn't used to wind you, is a classic sign of low blood oxygen. Your body is essentially gasping for air, trying to pull in more oxygen to compensate for the low levels in your blood. Don't brush this off as simply needing to hit the gym more often. It could be your body's way of saying it's not getting enough oxygen to function properly. Pay attention to when this shortness of breath occurs. Is it only during physical activity, or do you feel breathless even when you're resting? If you're experiencing shortness of breath at rest, this could indicate a more serious oxygen deficiency. Sign #2, rapid heartbeat or heart palpitations. Have you noticed your heart racing even when you're just sitting still? This rapid heartbeat, also known as tachycardia, is your heart's way of trying to circulate more oxygen-rich blood throughout your body. It's compensating for the lack of oxygen by pumping faster. While an occasional flutter is normal, persistent rapid heartbeat or frequent palpitations could be a sign that your blood oxygen levels are consistently low. Pay attention to these cardiac clues. They're your heart's way of sending an SOS. You might also notice that your pulse feels stronger than usual, or that you can feel your heartbeat in your neck or wrists. These sensations, combined with a rapid heart rate, are your cardiovascular system's way of trying to deliver more oxygen to your tissues. Sign #3, confusion or difficulty concentrating. Are you having trouble focusing at work or remembering simple things? Do you feel like you're constantly in a mental fog? Low blood oxygen levels can significantly impact your cognitive function. Your brain requires a constant supply of oxygen to operate at its best. When it's deprived of oxygen, even slightly, it can lead to confusion, memory problems, and difficulty concentrating. If you've been chalking up your forgetfulness to stress or lack of sleep, it might be time to consider whether low blood oxygen could be the culprit. You might notice that you're struggling to complete tasks that used to be easy for you. Maybe you're forgetting important dates or appointments, or finding it hard to follow conversations. These cognitive symptoms can be particularly frustrating and may impact your work and personal life. Sign #4, bluish tint to skin, lips, or nails. Have you noticed a slight blue tinge to your skin, especially around your lips or fingernails? This condition, known as cyanosis, is a telltale sign of low blood oxygen levels. When your blood isn't carrying enough oxygen, it can give your skin a bluish hue. This is particularly noticeable in areas where blood vessels are close to the surface, like your lips and nails. While this sign is more obvious in people with lighter skin tones, those with darker skin may notice a grayish or whitish tint instead. Don't ignore these color changes. They're a visible indicator that your body isn't getting the oxygen it needs. The blue tint might be more noticeable when you're cold, as blood is diverted away from your extremities to protect your vital organs. If you notice this color change becoming more frequent or intense, it's crucial to seek medical attention. Sign #5, headaches. Are you experiencing more frequent headaches, especially in the morning? Low blood oxygen levels can cause the blood vessels in your brain to dilate, leading to headaches. These headaches are often described as a dull, constant pain, rather than the sharp or throbbing pain associated with other types of headaches. If you're waking up with headaches more often than not, it could be a sign that your oxygen levels are dropping while you sleep. This is particularly common in people with sleep apnea, a condition where breathing is repeatedly interrupted during sleep. Don't let these headaches become your new normal. They could be a sign of a more serious underlying issue. Pay attention to the timing and nature of your headaches. Do they improve as the day goes on? This could indicate that your oxygen levels are lowest during sleep and improve as you become more active and breathe more deeply during the day. Before we continue, if you're finding this information valuable, please take a moment to smash that like button and subscribe to our channel. Your support helps us create more content like this to keep you informed about your health. Now, let's move on to the next 5 signs. Sign #6, fatigue and weakness. Do you feel exhausted all the time, even after a full night's sleep? Persistent fatigue and weakness are common symptoms of low blood oxygen levels. When your cells aren't getting enough oxygen, they can't produce the energy your body needs to function properly. This can leave you feeling drained and weak, even after minimal exertion. If you're constantly reaching for that extra cup of coffee or struggling to make it through the day without a nap, it might be time to consider whether low blood oxygen is the root cause. This fatigue isn't just feeling sleepy, it's a deep, pervasive exhaustion that doesn't improve with rest. You might find that even simple tasks like making dinner or taking a shower leave you feeling completely drained. This is because every cell in your body is struggling to function without adequate oxygen. Sign #7, dizziness or lightheadedness. Have you been feeling unsteady on your feet or experiencing frequent dizzy spells? Dizziness and lightheadedness can be alarming symptoms of low blood oxygen levels. When your brain isn't receiving enough oxygen, it can affect your balance and spatial awareness. This can make you feel like the room is spinning or like you might faint. These symptoms can be particularly dangerous as they increase your risk of falls and accidents. Don't brush off these dizzy spells. They could be your body's way of signaling a serious oxygen deficiency. You might notice that these dizzy spells are more frequent when you stand up quickly or exert yourself. This is because these actions require your body to quickly adjust blood flow and oxygen delivery, which can be challenging when your oxygen levels are already low. If you're experiencing frequent dizziness, it's crucial to take precautions to prevent falls and seek medical attention. Sign #8, changes in skin color. Have you noticed changes in your overall skin tone? While we mentioned the bluish tint earlier, there are other skin changes to watch out for. Pale or ashen skin can also be a sign of low blood oxygen levels. This is because when your blood isn't carrying enough oxygen, it can affect the color of your skin. You might notice this change all over your body, or it might be more pronounced in certain areas like your face, hands, or feet. If your skin seems unusually pale or grayish, it's worth considering whether low blood oxygen could be the cause. In addition to color changes, you might notice that your skin feels cooler to the touch, especially in your extremities. This is because your body is prioritizing blood flow and thus oxygen delivery to your vital organs, potentially at the expense of your skin and extremities. Sign #9, restlessness or anxiety. Have you been feeling unusually restless or anxious for no apparent reason? Low blood oxygen levels can trigger feelings of unease and anxiety. This is your body's natural response to not getting enough oxygen. It's trying to alert you that something is wrong. You might feel fidgety, unable to relax, or experience a sense of impending doom. While anxiety can have many causes, persistent, unexplained anxiety could be your body's way of telling you it's not getting enough oxygen. Don't dismiss these feelings. They could be important clues about your overall health. This restlessness might manifest as an inability to sit still, a constant need to move or adjust your position, or a general feeling of discomfort that you can't quite pin down. You might also notice that you're more irritable than usual, or that small stressors seem to affect you more than they typically would. Sign #10, swelling in your extremities. Have you noticed swelling in your ankles, feet, or hands? This condition, known as edema, can be a sign of low blood oxygen levels. When your blood oxygen is low, it can affect your circulation and cause fluid to build up in your tissues. This often shows up as swelling in your extremities, particularly in your legs and feet. You might notice that your shoes feel tighter, or that you can leave an indentation in your skin when you press on it. While there are many causes of edema, persistent swelling could be a sign that your body isn't getting enough oxygen. This swelling might be more noticeable at the end of the day, especially if you've been on your feet a lot. You might also notice that the swelling improves when you elevate your legs, but returns quickly when you stand up. If you're experiencing persistent swelling along with other symptoms we've discussed, it's important to consult with a healthcare provider. Now that we've covered these 10 critical signs of low blood oxygen, you might be wondering what you can do about it. Remember, if you're experiencing any of these symptoms, it's crucial to consult with a healthcare professional. They can perform tests to check your blood oxygen levels and determine the underlying cause. There are several medical conditions that can lead to low blood oxygen levels, including 1. Chronic obstructive pulmonary disease, COPD, 2. Asthma, 3. Pneumonia, 4. Anemia, 5. Sleep apnea, 6. Pulmonary fibrosis, 7. Congenital heart defects. Your healthcare provider can help identify if any of these conditions are contributing to your symptoms and develop an appropriate treatment plan. But as promised, we have a special bonus tip that could help boost your oxygen levels naturally. Are you ready for it? The secret weapon against low blood oxygen is deep breathing exercises. That's right, something as simple as focused, deep breathing can significantly increase the amount of oxygen in your blood. Here's a quick exercise you can try right now. 1. Sit or stand comfortably with your back straight. 2. Place one hand on your chest and the other on your belly. 3. Breathe in slowly through your nose, feeling your belly expand. 4. Hold your breath for a count of 2. 5. Exhale slowly through your mouth, feeling your belly contract. 6. Repeat this process for 5-10 minutes several times a day. This simple technique, known as diaphragmatic breathing, can help increase the oxygen saturation in your blood and improve your overall well-being. It's a powerful tool you can use anytime, anywhere, to give your body the oxygen boost it needs. In addition to this breathing exercise, there are other lifestyle changes that can help improve your blood oxygen levels. 1. Regular exercise. Physical activity can help improve your lung capacity and efficiency. 2. Quit smoking. If you smoke, quitting can significantly improve your blood oxygen levels. 3. Maintain a healthy weight. Excess weight can put pressure on your lungs and make it harder to breathe deeply. 4. Stay hydrated. Proper hydration helps your blood carry oxygen more efficiently. 5. Improve your posture. Sitting up straight allows your lungs to expand fully when you breathe. 6. Get fresh air. Spending time outdoors, especially in green spaces, can help increase your oxygen intake. Remember, while these tips can help, they're not a substitute for professional medical advice if you're experiencing symptoms of low blood oxygen. There you have it. 10 hidden signs of low blood oxygen, potential underlying causes, and bonus tips to help combat it. Remember, your body is incredibly clever at sending you signals when something's not right. By paying attention to these signs and taking action, you can help ensure your body gets the oxygen it needs to thrive. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell to stay updated on more health tips and tricks. And remember, we've included links to some great testosterone-boosting supplements in the description below. Thanks for watching, and here's to breathing easier and living healthier. Stay oxygenated, my friends.